living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
About 1 in 8 women develop breast cancer during their lifetime. Due to new technology and screenings, thankfully only 40% of women will die from this type of cancer. And it's important to know that men can also develop the disease. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Pam Sasser, your host. Stay tuned to learn more about cancer. Welcome back to Healthy Living for Life. Joining us first this morning is Carol Hatfield. Carol is a breast cancer survivor. Good morning, Carol. Thank you for joining us.
Good morning. Thank you for having me.
Absolutely. So, Carol, when were you first diagnosed with breast cancer?
October of 2017.
You want to tell us a little bit more about that? You know, I guess mostly, how did you feel when you first heard this news? Were you scared? Were you frightened? Tell us about that.
Okay. So I went in and got my mammogram, and right away heard back from the doctor, and they asked me to come back in, that they had found something. And so of course my heart dropped, and yes. I was actually in Hallmark picking up some cards for some of my friends, and called my husband. He met me at the doctor's office, and they broke the news, and I sobbed. And we moved on and said, what are the next steps? And he gave me some options as far as oncologists go, and we made a plan and moved through.
That's good. How old were you when this news came to you?
51.
Okay, so you're a young person.
Mm-hmm.
So talk to us about family history. I know a lot of folks who do end up getting diagnosed with breast cancer they have a family history of breast cancer. Was that the case with you?
No history of breast cancer on either side of my family. So it was fairly surprising for me. The cancer that I had was DCIS, ductal carcinoma in situ, which is non-invasive, but it is uncontrolled growth of cells in the milk ducts, but not invasive. So caught it early with early detection, and from there made a plan, and it turned out really well.
And is this something that you'd notice on a self-breast exam, or no, that was simply just found via getting a routine mammogram?
Mm-hmm. Yeah, not a self-breast exam, didn't notice anything, everything seemed normal to me. Actually, when I got my mammogram, they showed up. I had 2 different clumps of cells, and they called me back, and I had to actually do an ultrasound, and then I had to do I think it was called a stereotactic biopsy, so they could determine it even more.
Okay. So I understand you've already gone through treatment and your cancer is in remission. That's great news. Can you tell us about what treatment was like for you? Walk us through that process.
Yes. So they gave me several options. One was a study with just a hormone therapy. One was mastectomy, and one was lumpectomy with radiation. And I debated really on what to do. I knew I did not want to have a mastectomy because I just really wasn't a candidate for that. So I debated really between the study and the lumpectomy. And hearing the word cancer is so scary. I just wanted it out, so I chose the lumpectomy with radiation, and then it would have been a follow-up with 5 years of hormone therapy.
Okay, awesome. So did you have moments of doubt when you were going through the treatment? How did that go for you? Were you feeling like everything was going as you thought it should?
Yeah, at first I had moments of doubt because I kept asking my oncologist, do I need to get a second opinion? And we just felt with the early detection and catching it early, I was okay to stay in Bozeman. That's where I had all my, the majority of my surgery and treatment there. And I didn't get a second opinion, but I kept thinking, is this the right choice? Am I doing the right thing? Is there something else out there that I should be looking into? And definitely considered going out of state, but the options and just everything, knowing with the cancer that I had, I ended up staying in Bozeman and going through the surgeries. I actually had 2 lumpectomies, and then I followed up with 3 weeks of hypofractionation radiation, which is 3 weeks rather than 5 weeks.
Okay. Have your diet and exercise changed since you've
Yes.
gone through treatment?
Yeah, and that's one of the things that they definitely help you with is your diet and exercise, and spiritual as well, your just your whole well-being. And so definitely have changed my diet, and I exercise a lot more, not as much, but still get the exercise, and I think it's definitely made a change in my life.
That's awesome. What would it be advice that you would give to others who maybe don't get routine breast screenings?
Please get them. Early detection can help save lives. The year before, previous 2016, I chose not to get a mammogram. And I came super close to not getting another mammogram in 2017. And I don't know, something in my head just made me go do it. And I'm thankful for that, because otherwise it would have been a different outcome.
For those battling breast cancer, as in our last few seconds, what would you tell them about winning this fight?
Stay positive. Surround yourself with family and friends that care about you. There's a huge support group out there. Take care of yourself. The main thing is turning to your spirituality. That was a huge help for me in having faith, positiveness, exercise, and good nutrition.
Thank you so much for sharing with us, Carol. That's a great story, and thanks for being here.
Thank you.
Glad you're here. Up next is Breast Program Health Nurse Navigator Pam Sasser. Stay tuned. Joining us now is Pam Sasser, Breast Health Nurse Navigator for St. Peter's Health. Thanks for being on our show, Pam.
Thank you. It's good to be here.
Yes, excellent. So can you talk to us about what you do for patients as a breast health navigator, and maybe even share a patient story with us?
Sure. So people always ask the question, what do you do as a navigator? And it's really kind of hard to define exactly what that role is. But I typically get involved with a patient when they're recommended for a breast biopsy. So I visit with them and explain what's going to happen, kind of walk them through that process. And then the majority of the biopsies come back negative, but if it does come back positive for a breast cancer, then I help navigate them through that entire continuum of care. I help alleviate any barriers. I act as kind of that conduit. So, because once a breast cancer diagnosis is made, things go pretty quickly, and there's a lot of different teams that are involved: the surgeon, the medical oncologist, radiation oncologist, sometimes genetic counseling. So I just kind of help to be that main focus and kind of be that support, provide educational and emotional support for that. So.
Excellent. So how about, do you actually also provide support on prevention and educating people on prevention of breast cancer?
Yeah, so I love that piece. I love to get out and educate the public. A lot of the things we'll do through St. Peter's is we'll do activities to where we're doing education and promotion on prevention, not just breast specific, but other types of cancers. So you may have seen our presence at the Carroll College basketball games, volleyball games. We've been present there. Dr. Abentroth will go and always talk and, encourage women to get their mammograms. Always, starting age 40, get out and do your yearly mammograms. But yeah, so anytime we have an opportunity, we've also gone and talked to the different high school activities, like volleyball again, and just talk about the promotion of basically at that age is more like, just healthy behaviors.
Excellent. Can you talk to us a little bit about what folks can do to prevent breast cancer?
So the big thing, with most chronic diseases, you want to have, a good diet. So anything, especially for breast, they have found that things that are high in cruciferous, like your cruciferous vegetables, so broccoli, cauliflower, anything like that can be helpful. And then also high antioxidants. So your berries, so I always encourage people to just kind of eat the rainbow, so you want to have lots of fruits and vegetables. You want to limit your red meat, your caffeines, definitely alcohol and tobacco. A lot of cancers have proven that alcohol can cause, and breast is one of them. So
are there some common myths about breast cancer that you can shine some light on?
Sure, yeah. There's actually quite a few, and it's kind of surprising when I do get out and start talking to the public and people's differing opinions. One of the biggest one is probably family history. I hear all the time like, oh, I don't need to worry about breast cancer, it's not in my family. And the biggest risk factor is being female and having breasts. So the genetic component, yes, that exists, but it's a much smaller ratio than people think. Another thing is young women don't get breast cancer, and that's not true. I've navigated a good population, that are under 40. Another misconception could be that men don't get breast cancer, when in fact they do. So, those myths that are out there, or, if you aren't experiencing pain, then it's not a breast cancer, so trying to help to dispel those myths. And I always encourage anybody, if you have any kind of a question whatsoever or a concern, go in and see your primary care provider and make sure that they follow that up appropriately.
Is there a piece of advice that you would give someone, a primary first piece of advice if they were newly diagnosed with breast cancer?
So the biggest takeaway on a brand new diagnosis is to be careful who you talk to, because everybody wants to share a story and none of the stories are the same. There's probably about 15 different types of breast cancers that are out there, and not everyone is the same. So, your story is going to be different than her story versus, somebody else's. So be very cautious on who you're talking to. And then also too, I just tell people to just take it one day at a time. It's very stressful. And, I also encourage people that the majority of our breast cancers we're catching much earlier. So our cure rates are, in a very high percentage. So when you're hearing the media and all these scary stories, know that that's probably not their story. So try to keep positive and encouraged.
Good advice. So we have time maybe for one last question before the break. And would you have some advice for friends and family who are interested in supporting, those with breast cancer? What can they do best to do that?
So the big thing there for family or loved ones is to just listen to the patient, kind of watch their cues. Sometimes, their family member might act like they're doing great, but maybe, like things that they enjoy typically doing, they're not doing anymore. So kind of pick up on those cues and let them tell you what they need. Sometimes you just assume they need this, where in fact, maybe I don't need that today. Maybe today I just need to sit and read a book and be quiet, or other times it's maybe volunteering to take them to their appointments, or let's go see a movie. Sometimes, it's just helping. Just let them know that you're there and available. And sometimes it's hard for people to have that, face-to-face conversation. We have our cell phones now, so maybe it's, sending a quick text thinking about you, or can I bring your family something? What does everybody like? Is there a certain food that you're not interested in having? And let me help.
Great. We'll pause for a quick break. In a few minutes, we'll be back to learn more about Pam and different types of breast cancer treatments after these messages. Don't go away. Welcome back. We're talking with Pam Sasser, Breast Health Nurse Navigator for St. Peter's Health. Welcome back.
Thank you.
Yes. So I'd like to go back to something we talked about earlier, and that is breast cancer prevalence in men. Can you tell us how common that is?
It's actually not that common.
Okay.
It's probably less than 1% of the overall breast cancers that are diagnosed, but still you're looking at about roughly 2,500 males diagnosed per year, which can be pretty significant. And of course, it's a little bit more difficult when a man's diagnosed with breast cancer because there really isn't a whole lot of resources out there. The education is pretty similar, but it's just trying to find that support and the acceptance.
Sure.
Because it can be pretty challenging.
Okay, thank you. So can we talk about the different types of breast cancers and the names and characteristics of each of those?
Sure. So as I had mentioned previously, roughly about 15 different types. And they can stem from, there's different locations within the breast of the ducts or the lobules. Then there's also ones that are fed by hormones, estrogen and progesterone. There's a typical, another one that's not as typical, and it's a HER2/neu, and that's a protein that can be found on breast cancers. And in about 20 to 25% of the breast cancers, that can be positive. And so one of the things people may talk about is, oh, I'm triple positive or I'm triple negative. Those cancers are a little bit more aggressive. And so, the treatments are very effective, but we just want to make sure in those circumstances that, we are getting on those and treating them a lot sooner. So again, it's very important for women to get in and be doing those yearly mammograms, doing your own self-breast exams and then clinical breast exams. But as far as the different types, there's also early stage, like a stage 0 is called a ductal carcinoma in situ. So, it just varies. And some women, unfortunately, are diagnosed at a metastatic stage. So,
Okay. Is one type of cancer, breast cancer, more common than others?
Probably the most most common diagnosis is the invasive ductal carcinoma. We sometimes refer to it as the garden variety.
Okay.
And that one would have the hormone sensitivity, but that HER2/neu protein negative. So that's probably the most common that's diagnosed.
Okay. And I think you mentioned this earlier, is there one type that's more aggressive than others?
Yeah, so that would be either your triple positive or your triple negative. And there has been phenomenal research going on right now with both of those types of cancers. So a lot more treatments are becoming available, whereas even just, 6 months ago for triple negative, we didn't have an extended after chemotherapy therapy treatment that people could use, and now they've come out with something. So,
good.
Yeah.
Good news. Do we know what the root cause of these types of cancers are? Do we have any information on that?
Well, I think we're definitely finding more links to it, but we haven't yet found, like the magic culprit, if you will. Again, the diet, certain lifestyle risk behaviors can wreak havoc to our cells and maybe, shift a cell into behaving to turning into a cancer cell. But as it stands right now, we don't know anything specifically. There is that genetic component, but again, it's a smaller population. So definitely if there's questions in your family, talk to your family members. We are very fortunate here in Helena that we have genetic counseling through Shodare Genetics. So we always encourage people, if you do have a strong family history, to talk to your provider, and they could do a referral, and then they could talk about that piece. So.
Our earlier guest, Carol, her breast cancer is in remission. Can you talk about what that means?
Yes, so those are always good words we like to hear. Right now, the term that we like to use rather than remission is no evidence of disease. So what that means is everything looks clear, the scans are great, blood work comes back normal. Unfortunately, women still live in fear, that it's going to come back. So it's really hard. It's great to hear that somebody's in remission or, has no evidence of disease at that time. But unfortunately, that stressful emotional component for a lot of women, it just weighs heavily on them.
Absolutely. Can you talk about the different stages of breast cancer just briefly?
Yeah, so there's actually 5 different stages because we count stage 0 as one. So stage 0 would be a precancer, and then your earlier stages are your stage 1 and 2. Those are ones that sometimes just surgery alone can treat. Sometimes they require a little bit of radiation therapy after a surgery, or sometimes they need surgery, chemotherapy, and radiation. Stage 3 and 4 are a little, those are your more advanced. Stage 3 is still curable, and then when you're looking at stage 4, that's considered metastatic. So at that point, we do have women that have been metastatic with breast cancer living 25 years. So it doesn't mean that, it's a end of life sentence, but, at that point they're treating for quality of life. They're not treating for a cure, but there's still great hope with those.
So you've already kind of hit on that, and we just have a few seconds left, but breast cancer can be cured or eliminated, or is it always even there after treatment then?
It can be cured, yep. If we get it early enough and it's those early stages, we are looking at, upwards to 95% cure rates. A woman is still at risk for getting a recurrence or another breast cancer, so they still have to be diligent.
Great. Thank you so much for being here, Pam.
Thank you.
It was great information today. And I'd also like to thank Carol for sharing her story. See you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.